April is Autism Awareness Month, and as we get into Autism Awareness Month, it's good to consider all the different factors that go into treating autism and those that affect families and individuals right here in Oakland County. Joining us to talk about that is Metro EHS's Anthony Dabish from Metro EHS, which specializes in a variety of pediatric therapies. Thank you for being with us today.
Yeah, thanks for having me, Tyler.
Yeah, glad to have you on because we've had you on before to talk about some of the varieties of different forms of pediatric therapy that your organization takes part in and helps families and individuals right here in our local area. But autism is something that as we've learned more about it over the course of time, we have developed an understanding of autism as being on a spectrum, and there's a variety of different ways that autism manifests itself, especially in children, and a variety of different ways I would imagine too that it is treated. So can you elaborate on that and some of the different ways that your business helps families and helps individuals that are affected by autism spectrum disorder in terms of treatment?
Yeah, we provide a service called applied behavior analysis, and what they do, they help children that are all over the spectrum. For instance, like limited speech, poor eye contact, frequent behavior outbreaks, limited focus and attention. We provided therapy for as well as for children to hit their motor skills goals, uh, social skills, language and communication, even small stuff like playing and leisure and learning and academics, and as well as self care.
And so when you have a child or a family that brings their child in for your assistance and for some of these therapies, you mentioned that they do go through a certain process to determine what is necessary for these kids. But it can be tough to treat autism spectrum disorder because of the various different behavioral aspects that come into play for one child versus another. It manifests itself differently in each individual. So where does that process start for you and your professionals as you're working with these families and individuals, because therapies are always going to work at a different pace and a different effectiveness
hmm
for every person?
Every child is different. You're right about that. The process actually starts with if the parent notices something different or odd about their child, what they can do is contact. The first step is actually contacting their insurance company. The insurance company then sends them to a psychiatrist to be evaluated to see if they fall anywhere on the spectrum for autism.
And then, Anthony, as you're working with these families, I would assume too that that involves working with their primary care provider, with their psychiatrist, to get a better understanding of this individual child or these individual children's situation on the autism spectrum. So how does that relationship work too, and how does that factor in to the different therapeutic approaches you take for one child versus another with autism?
What's great about Metro EHS is that we have specialists that work on our team that actually help the parents and assist them in getting the right professional help that their insurance will cover, as well as their pediatrician. We communicate with everyone that the family is associated with, so we can make sure that the child actually gets the help that he or she needs.
We're joined on today's program by Anthony Dabish. He is the sales and marketing specialist at Metro EHS. You can find more information on Metro EHS, including all their locations, including right here in our local area, by visiting metroehs.com. Metroehs.com is their website for more information. And going to a psychologist or psychiatrist, certainly consulting with a primary care provider, are great ways to at least begin or continue to address treating a child with autism and helping them adjust to the world that they're in and living a normal life while on the spectrum. But how can a pediatric therapeutic solution like yours at Metro EHS also help to add on to that and really bolster that base of care for a child on the spectrum?
We have all our therapists at every one of our centers. We provide a wide range of therapies for children. Um, a lot of children that fall on the spectrum also are going to need like speech or occupational therapy. And what's good about our centers is that we provide all of them in one center, so the parents aren't driving from one place to another. Um, a lot of children that end up going to applied behavior analysis also are going to need speech, as well as occupational therapy or even physical therapy. And we provide all that in one center, which is very good for the parents, convenient for them.
More information can be found, including ways to get in contact with them at Metro EHS on their website, metroehs.com, metroehs.com, or call them 313-278-4601, 313-278-4601 for more information. In terms of outcomes, how do these therapies help to ideally better the outcomes for treatment for these kids? What sort of results do you tend to see? And of course, it's going to be different patient to patient.
Yeah, it's different from patient to patient, but to be honest, I've actually seen parents crying on how a miracle turned out with their child. Like they sometimes come off as being like, okay, my child's special or different, but the thing is, we bring the superhero out in every child, and I've seen parents crying. I've seen just the joy of how much therapy actually improves their child.
Yeah, having a brother on the spectrum, I understand the perspective of the various ways that autism can affect one person versus the other, between the friends that he grew up with and their affliction with autism spectrum disorder, and just seeing that sometimes it is just some minor disconnects from neurotypical individuals. And sometimes they can be some wide-ranging swings in neurodivergence. But in these cases, these therapies can really provide that stepping stone to not necessarily eliminate those issues that may come along with normative behavior, but also but instead of ignoring them, so to speak, and letting them become problematic potentially, they really do have an effect that is intermediary and can develop over time to not necessarily reverse those issues, but make them workable for this individual as they're navigating through their life.
Yeah, especially the younger the age, the better outcome they're going to have. Um, and you're right about that. If nothing's taken care of, it could be problematic when they're a young teen, even as they're an adult. But taking care of it, or fixing the issue right away, is the best way to come about it at a young age.
More information and ways to get in contact with Anthony Dabish and the team at Metro EHS can be found on their website, metroehs.com, or you can call them 313-278-4601, 313-278-4601. And for parents, what should they be considering before they bring their child to an organization like yours for some of these therapies? Because obviously, as you mentioned earlier, they're going to want to consult with their primary care physician, with their psychiatrist for their child, to make sure that they're approaching this from the right angle and that they have the coverage in their insurance. But what other considerations should parents be making so that they're putting their child's best foot forward in these treatments?
The best thing you can do is actually give us a call, 313-278-4601. And what they can do is actually, we can do an evaluation for them to see if they belong or need to come to our center. If they are asking themselves questions about their child and stuff like that, we can actually do an evaluation, see if there is something that we can help them with.
And again, the number is 313-278-4601, 313-278-4601. You can also find more information about the variety of different therapies for children that are on the autism spectrum and for other children as well that may have a variety of different issues that need to be addressed by visiting metroehs.com. As we're focusing primarily on autism spectrum disorder, Anthony, but there are other issues that you also help families and parents to address as well. Can you talk about some of those and the other various treatments that you provide at Metro EHS?
Yeah, so ABA is mostly for kids that are on the spectrum. We provide speech, occupational therapy, physical therapy, as well as feeding and swallowing, which has become a big issue with a lot of children these days.
And again, all that information on the different services can be found on metroehs.com, metroehs.com, or 313-278-4601. 4601. We're joined by Anthony Dabish, who is a sales and marketing specialist at Metro EHS on today's edition of the Megacast. Anthony, before we let you go, anything else that we should be considering or that parents should be considering if their child is on the autism spectrum and they're seeking treatment from an organization like yours?
We do have 13 locations around Metro Detroit, which is we're trying to open up more as well. We just opened up one in Madison Heights as well as West Bloomfield. Um, you can go to our website and see all our 13 different locations, as well as by the end of the year, we're hoping to have a few more. The convenience is great, and our therapists are professional and great. And if you're looking to if you want to get a little more inside look, we're more than welcome to actually give you a tour of the place before uh, finding anything that you need.
313-278-4601 is their phone number, or you can visit them at metroehs.com. Anthony, thank you for joining us today.
Thanks for having me.